Good afternoon. I'm Janette Monear, and I am Executive Director of the Texas Trees Foundation. I have been in Dallas since the end of 2007. When I was initially approached to come to Dallas, I said no. I was appalled. And they kept coming back, and I kept saying no. And I kept saying no because I was coming from Minneapolis, Minnesota. And there was a huge cultural divide from where I was coming from to where I was going. And I didn't see how I could bridge that divide. So I thought very closely about coming, and finally I talked to my children and said, okay, let's try it. And the one thing that really moved me to come was I had just had breast cancer, and I needed something to focus on. I needed a big challenge, and Dallas was it. So when I got to Dallas, we didn't talk about urban heat. We didn't talk about climate change. We didn't talk about anything like that, because Dallas the culture was so based in energy, and I came from a state that was based in forestry. Having worked for the University of Minnesota in forestry, having worked for nonprofits there, and my career before that was in banking, I realized that I had to really take and put some different thought to how we move forward in working in Dallas. And I was really appalled when I came here, and this is kind of, since the beginning of history, humanity has modified and scarred the environment to convey some message. And that's what I saw of Dallas when I came here. So I thought, okay, what message are we conveying? This is in the middle. This image that you see here is in the middle of the Southwestern Medical District. It's where people that need healing and are sick, and there's some infirm and can't sometimes get around very well. This is what we have. So it's not just what we're creating in this city, it's what we're having to go back and recreate, right? So one of the things that we did is we looked at the medical district, and I'll tell you in a minute why. The medical district is an anchor area, an anchor district for the city of Dallas. We actually have 37,000 employees in the district. We just got the numbers yesterday. There's 2.9 million annual visits to clinics and ERs. There's 3,600 students and interns in this district. There's 16 miles of transportation corridors, and there's about 35 to 45,000 vehicles a day just on Harry Hines. And as I'll show you at the intersection of Harry Hines and Inwood, there's 82,000 cars a day that go through our medical district. And what does that do to us and our human health? A couple years ago, I guess it was a year ago this summer, I went to a conference in Austin, and it was the Transportation Commission, Texas A&M. And I came away from there horrified, let's just say horrified, at how we have actually developed our cities and what they are doing to us on a very cellular level. And it's frightening, and I think we all need to be concerned. So we turned our thoughts to, when I came, how can I make a difference in the city of Dallas in healing? And I wasn't even looking at a cellular level of healing. I was really just looking at how do we heal the landscape. Having worked on a public television documentary called Spirit of the Trees, I had the opportunity to work for 3 years with the Native American community and their connection to the land through their traditional ways. And it was empowering, and it was a transformational experience for me, because what I learned on that experience was our land, everything we stand on is energy. And we've covered up that land and that energy of our land, as Gail was talking about, with 38% impervious surface in the city of Dallas. So when I came here, I looked at this, we looked at the medical district, we looked at a lot of things. But mostly I was saying, how can I root myself in the city of Dallas for the Texas Trees Foundation to move us forward? So we did 2 studies. We did the State of the Dallas Urban Forest Report, and that's actually 3 studies in one. And that study showed, for me and the city, that we have 28% impervious, or we have 28% tree canopy. And the average tree canopy, or the best percent of tree canopy is usually around 40% in the city. So we had 28% tree canopy, and most of that tree canopy is in the Trinity Forest. So we decided to kind of look that, and out of the State of the Dallas Urban Heat study, it showed us all that we had 37.2% or something like that, impervious surface in the city of Dallas. Think about that. That's concrete. That's hard surface. That's why we flood. That's why we heat up. So this is what happens in terms of urban heat. It starts that you have an area, and it has no trees. It has all concrete. And you can see that in the red. Your temperatures oftentimes are a lot hotter in those areas. Last summer, I sent my staff out to look at the surface temperature of City Hall on a day when it was 105 degrees in the city of Dallas. City Hall surface temperature was 147 degrees, and Fair Park was 153 degrees. People can't live in that kind of temperature. So when we look at urban heat, we're looking at how do we mitigate the urban heat island effect in the city of Dallas. And one of the best ways and the cheapest ways and the healthiest ways is through an urban tree canopy, which means we have to get that urban tree canopy up from 28% to 40%. So we started to look at where some of those areas are, and the medical district was one. Our school campuses were another. Our school campuses, we know our children are not doing well. We have the highest rates of ADHD ever. We have Asperger's. We have children that have anxiety. I have a granddaughter that we've had to pull out of school because of anxiety. We're seeing diseases and problems that we haven't seen in our children ever. So Richard Louv came out and he wrote a book, Last Child in the Woods. It was transformational in how we are needing to get our children outside and out from behind computers. Our children are losing contact with nature, and that's affecting their health. We know that. So we started looking at, okay, where are we going to focus our urban heat island mitigation? And we looked at all of the schools. We did inventories of every school in DISD, in the Dallas Independent School District. And we found that there is less than 7% tree canopy on the campuses, and most of our children were not even going out. And at that time, they weren't even having recess a lot of times. So we launched actually 4 programs. We launched our Cool Schools program, which we're doing right now, and we've designed that with City of Dallas. Willis has helped us get our Cool Schools Community Parks program. So we have prioritized those areas that are in urban heat islands, but also that can connect to a neighborhood within a 10-minute walk, which you heard about earlier that the Trust for Public Lands are doing. But the health implications are what I keep coming back to. And one of the things I've been doing some research on, because I'm getting ready to launch about a $200 million or $250 million project in the medical district. But how am I going to do that? I'm not a landscape architect. I'm not an urban planner. I'm not an architect, but I know what I know. And having worked in this field for 35 years, I know that we need to approach the medical district in a very different way. So I started looking at what does that mean? Because we have a lot of plans that we can do, but how do we uncover the history of the area that we're going to be working in? So I've hired a historian to come in and look at that, because the history matters. Our DNA matters. Whether it's the land DNA or our physical DNA, it matters, because where we come from is what we need. And one of the things about all of us greening in all of these projects that we're doing is it resonates actually to our soul, to our DNA, because we come from a hunter and gatherer. And I started looking at who's talking about this. And the only one that I really found that was talking about it a lot was Dr. Timothy Beatley at University of Virginia. And he and I have had a lot of conversations. Now this is a process, right? But the idea of biophilic design is that our built environment is critical to people's health, productivity, emotional, intellectual, and our spiritual well-being. And spiritual doesn't mean religious. It means what do we need at a soul level to really heal ourselves and our cities. Because if we're not healthy, our cities aren't healthy. So that's kind of what drives me in this project. I'm just really kind of getting in this. I'm not a scholar on this, but I really feel that this is kind of something that we need to be looking at. We need to look at the history, and I've heard several on these projects this morning, the history, how we're looking back at the culture, how we're making things more equitable, and this is kind of driving how we're doing what we're doing. I believe that as we continue to create our parks, as we continue to really design our cities differently and more on a regional scale rather than parcel by parcel, that we will see less stress hormones and less anxiety, less cancers, less cardiovascular problems, less diabetes, and less dementia. And I have a feeling, and I can't prove it yet, but we do know that from Urich's studies back in the 70s, he studied that, and it goes in his studies show that people that have surgery, he did and it's been this study has been replicated several times. But people that look at trees in nature after they've had surgery have 20% less post-operative complications. That's big. That study has been replicated every time. The reason that I kind of dive into the tree piece is because trees actually produce terpenes and isoprens, and they activate cells in your body that actually activate cancer cells. We know this research now. That's why they talk about forest bathing. The Japanese have done this forever, but forest bathing is where you actually go into the woods and you just walk. You just literally walk. And that actually brings down your stress levels, and it actually allows you to inhale these terpenes that come, and mostly the terpenes come from the pine trees, the isoprens come from deciduous trees. But that's what activates these healing cells in your body. So as we move forward in a medical district, and knowing what I know around this, there's no way that we can design to this without thinking about the health and well-being. So the other things that have to come into planning, though, from my perspective, and this is why we're looking at this, is education. These are different facets of what we're doing, because business as usual is over. And we have to figure out, and that's what we're trying to figure out through this project, bringing in the arts and humanities, bringing in the education and research, bringing in the environmental pieces that Brent talked about. Economic development is already happening, and we've just got the master plan, the schematic designs, the conceptual designs on this, and the operations. We know, how do we design this area for autonomous vehicles? How do we design this area to really make a difference and bring all of these together? One of the things that I have promised our congressional members is that we will track and look at policy. And how can we change policy so we can all do things differently when things are federally funded. When federal funds come into the state, we can't always do what we want to do because of the mandates that come with that. So back in an example of that is as we start to design Harry Hines, back-of-curb sidewalks. Back-of-curb sidewalks are stressful. There's no place to plant a tree between the street and the sidewalk if you have a back-of-curb sidewalk. And every time I walk down the streets of the medical district, I'm always looking back because cars are coming at me 45 miles an hour right behind me, and you can hear it and you can feel it and you get stressed. But that shouldn't happen in a medical district, right? When we started this plan, and we talk about public-private partnerships, Lyda Hill, a philanthropist here in Dallas, funded us to do the conceptual plan. And it can be found on texastrees.org. But we looked at, when we started this from the very beginning, what are the health aspects of this? What is the impact on human health in a medical district, and how are we going to design around that? So we have kind of moved forward. This is the design framework of the district. Now the district is 1,000 acres. We're working on about 600 of those acres. And it's about 21 miles of streetscape. Now we've been relegated to the public right-of-way, but we are now finding that the 3 major hospitals in the district are looking at us and saying, well, we want to move our master plans forward, but we want to know what you're doing because we're going to connect to what you're doing. And the other thing that's happening is that we've looked at this and how do some of these streets really work? So it's not just one street we're working with the whole district. And how does that all interact? And how do those grids work together? And where do we need new streets? And so it's not just about designing the district, it's about looking at where and how we're going to design it differently. This is the green spine, which is Harry Hines. Harry Hines is actually a 1942 major highway that went from Dallas to Denton. And it goes through the heart of the district. And it's where we will begin. It links all of the primary destinations together. And it really is about creating a green street here, but more than that, it's connecting all of the buildings, all of the built environment in the district, so it is one campus. And how do we kind of slow traffic? Right now, traffic goes down Harry Hines at 45 miles an hour, and you cannot get across Harry Hines. And it's excruciatingly hard to watch an old woman with a cane or a walker because they can't get across it. So how do we take all of these challenges and take it to a level where no matter what we do, it impacts positively in the health and stress of everybody? So this is Harry Hines. This is kind of what we're looking at. This was in our master plan. We're looking at how we design this exactly for autonomous vehicles. So if you see there's 3 lanes, we're going to shut off 1 lane just for shuttles and autonomous vehicles and on demand. One of the demands is that doctors go from one hospital to another hospital to another hospital every day. And they get in their cars and they drive less than a quarter of a mile. The other thing that happens with that is each hospital has their own parking garages, right? So they have to have special places where the doctors can park. And so instead of having patients being able to use some of those places, the doctors are using them. So on demand. But how do we design a streetscape for autonomous vehicles for people and get cars off of here? This has about 45,000 cars a day. It's a cut through, and we know that we can get them off, but that's going to be probably one of our battles. This is the intersection of Harry Hines and Inwood. We call this the Green Heart. And this is where we engaged Peter Walker. And I have had the honor to work with Pete, and honestly, it has been really transformational. He has a sense of design and a sense of space, a sense of place. And we're struggling with this intersection because we've been given permission by the state to take this cloverleaf out. Now this intersection where you see the cloverleaf and kind of the whole thing, it's 14 acres. So 14 acres, what can we do with 14 acres? And we've got some really good ideas. So this is a major problem. Also notice on this that only, say Inwood, you have very little of the traffic going Inwood or Harry Hines that are actually going on to Harry Hines to get into the district. So people that are using this are not even using the district. And what is our 82,000 cars doing to the air quality in that area? And that's going to be our biggest battle, is to get people out of their cars or re-navigate where they go. So Pete's team and us have come up with some ideas, and we're kind of thinking, okay, how can we do this? We can go with a regular intersection and kind of revitalize it. We worked with a team of ASLA and APA came together one night for a charrette, and I know there's 2 of you in this room that worked with us. And that was pretty transformational, because what that did is they showed us some new designs. Look at in column A, number 2 and 3, they said, well, let's look at this from kind of a more urban design perspective. And we took that back to the Board of Trustees for the Southwest Medical District, and we talked about urban design. We talked about the designs, and we took them what we would have if we did something different than just a regular intersection. And what happened in that meeting was they shifted, because they all own property all over the land, or all over the district, right? Now they're talking about what hospitals can, what parcels of land might they be able to exchange to actually better build and increase their footprints. All 3 hospitals are doubling their size. So this is going to be an important area. So what we have now is we're looking at a 10-acre park, either a whole park or divided, we don't know yet, because we looked at a rotary, and a rotary with 82,000 cars going around it won't work. It would be probably the biggest rotary in the country, but it won't work. So we're going out to see Peter and his team in a couple of weeks. And where I am with this is stuck, because I'm not willing to not have a design or a concept that people can't buy into and love and fight for to get 82,000 cars out of an intersection in a medical district. So we're going to get unstuck. We're going to keep working. In January, we are pulling our team together, and it's not going to be one company. It's going to be a very diverse team of people that we're going to choose to come together to do this project. And when we're done, we are really going to have 23 acres of streetscapes that are reclaimed. And these numbers don't really mean much to me right now, because we haven't gotten there. Because we can put numbers up here, but it's not just about the amount, it's about the quality of what we're doing in these 23 acres, in these 2 miles of streetscapes, in how we're getting all of that back to the place where it can be healthy. I'm concerned about a few things. I'm concerned about 5G. The American Medical Association doesn't support 5G, nor do they support Anything over, I think, 3,000 kelvins for LED. So how do I take a medical district and the AMA and design it again to meet these outcomes, but make it at a healthy level and a healthy cellular level? So when people walk through and go through and are in this district, instead of being stressful, they've got the aha moment. Thank you.